I just wanted to make sure that this thing is on, that it's finally working appropriately. And I think this is the best way to get the best video is using this software. So, just a quick introduction. My name is Dr. Isang, and I'm a cardiologist using this platform to be able to answer questions regarding the heart health and prevention. Why is it important? Because heart prevention is a lot better than treatment. What does that mean? It's a lot better, it's a lot cheaper, it's a lot easier on the burden on the family members and with the friends, people close to you. The treatment for it is just can be very complex. So if we can prevent someone from having a heart attack, that goes a long way. So what's the best way to prevent someone from having a heart attack? Understanding what the risk factors are. These risk factors includes things like hypertension or high blood pressure, high cholesterol, diabetes, strong family history, smoking, and just following up with your primary medical provider at least on a yearly annual basis. So if we know that you have high blood pressure, we could potentially treat that now and prevent a heart attack from happening. A lot of times, these risk factors don't show themselves until you've had a significant issue, such as a heart attack. So, people can go years, multiple decades without any showing of heart disease until they were having chest pain. They went to the hospital, they got a heart catheterization blockage, and sometimes it's too late to reverse the damage. And we're switching from primary prevention, so working on the risk factors to prevent a heart attack, to secondary prevention. What can we do to decrease the hospitalization, to decrease a second um, um, bout of heart failure or heart attack or the complications associated with it? So, if someone has a heart attack, what are the potential complications of this? We're talking about heart failure, the inability of the heart to pump effectively, leading to congestion. The fluid is backing up into the lungs, into the legs, into the abdomen, causing shortness of breath, um, weight gain, leg swelling that needs to be treated with a diuretic or water medication to help with peeing out the excess fluid. It can lead to the heart not pumping appropriately, which can lead to a reduced ejection fraction. And some of those individuals also need to have an ICD, a device that helps them to pump the heart appropriately. So if we can do our best to prevent this heart attack from happening, we can prevent the downstream effects from heart disease, such as heart failure, such as needing an ICD, such as death for some individuals. So, there are some people who will have symptoms of a potential heart attack. And what is that? Chest pain here, chest pain that radiates to the left shoulder, chest pain that gets worse with exertion or exercise, and chest pain that gets better with nitroglycerin or rest. So if you have these cardinal symptoms, we want you to be seen as quickly as possible because you could potentially um, you can potentially have on sorry you can potentially be treated appropriately to prevent this from happening. But you can have something called a cardiac catheterization, where we look to see if there's any blockage in your heart arteries, open it back up, and try our best to um, reverse as much damage as possible. We do understand that some people don't have these classical symptoms. Unfortunately, a lot of times we do see it in women who present more frequently with these atypical symptoms. Sometimes it can be shortness of breath, shoulder pain, back pain. We need to do our due diligence in these individuals because they have to be treated appropriately too. Fortunately, sometimes we do miss them, so you have to have a high sense of awareness of this to potentially prevent the adverse effects of a heart attack. So, what else can you do? You can do an echocardiogram, which is an ultrasound of the heart to look at how well the heart is contracting or squeezing. You can do a stress test, which can be an indication if there's potential heart damage. And if those are abnormal, can help in making the diagnosis of heart disease or a heart attack. A lot of times these things are negative and you have to follow up on an outpatient basis. So that follow up may mean doing further testings or even looking for other potential causes of heart disease. So this is just the intro to just stress the importance of prevention, but the importance of knowledge and knowing what these potential risk factors are, high blood pressure, high cholesterol, diabetes, strong family history, smoking, um, and just not following up. So it's always important to follow up with your primary care provider, ask these appropriate questions, and if needed, get further workup as recommended, possibly even a cardiology consultation. My name is Dr. Isang, and thank you for your time.